Hey biochemists, this is Chieko, and I'm here to talk to you about type 1 and type 2 diabetes. So, first, we're just going to go over the questions that we would like to answer in today's video. So, the first is 1. What are some similarities between type 1 and type 2 diabetes? Number 2, what is the underlying cause of type 1 diabetes and what are the effects of it? And 3, what is the underlying cause of type 2 diabetes and what are the effects of it? So first, we're going to go over some of the similarities between type 1 and type 2 diabetes. So to do that, first we're going to define diabetes. It's when glucose is overproduced by the liver and underutilized by other organs. This results in high blood sugar, and high blood sugar can have a lot of bad effects. Some of those are damage to blood vessels and nerves, high blood pressure, excessive urination, kidney and pancreas problems leading to fatigue, visual disturbances, and the risk of heart disease and stroke, and more. You don't have to memorize all of those, but just so you're aware of why this is important and why diabetes is something that so many people are trying to find cures and treatments for. So, another important similarity between type 1 and type 2 diabetes is that they are both based on insulin and either the inability to respond to insulin or the complete lack of insulin. So, that brings us to our second question. What is the underlying cause of type 1 diabetes and what are the effects? So insulin's role in this is basically that there is no insulin. The body's immune system attacks the pancreatic beta cells for reasons that we don't exactly know right now, causing no insulin to be secreted. Because as we went over in the insulin secretion video, the pancreatic beta cells is where insulin comes from. So, an important note to this is that glucagon is released from alpha cells of the pancreas in response to low insulin levels. So, in the case of no insulin levels, the body is always in a glucagon state. And this causes the complications above and commonly results in weight loss. It used to be that the odor of acetate on the breath was used to diagnose it, and it is fatal due to the change of pH in the cells and blood. It makes your blood a lot more acidic. So basically, if the body is in a glucagon state all the time, glucagon is signaling for the breakdown of glycogen and the stimulation of gluconeogenesis, which is the formation of more glucose from any fat that the body does have on it, which is usually not a lot in the case of type 1 diabetes. This causes high blood sugar, even though there's a lot of glucose already in the blood, it's causing the body to make more glucose. So, this brings us to type 2 diabetes. What is the underlying cause of type 2 diabetes and what are the effects? Again, it's because it is caused because of a complication with the insulin pathway. But in this case, type 2 diabetes occurs as a result of insulin resistance that is developed over time. So, current research suggests that one reason for insulin resistance developing is because of too many fatty acids circulating, which overwhelms the adipose tissue's ability to incorporate them. So, we'll go over this kind of with a picture because it's a little bit easier to visualize. So basically, because there are so many fatty acids circulating in the blood, fatty acids begin to accumulate in the muscle. Triacylglycerol is formed, and one of the intermediates of triacylglycerol is diacylglycerol. Diacylglycerol is a signaling molecule that stimulates protein kinase C, and protein kinase C phosphorylates the IRS protein at the serine and threonine residues rather than the tyrosine residues that the insulin receptor phosphorylates. So down below, you can see that over here in 1, these residues are phosphorylated at the tyrosine, and then that would stimulate phosphoinositide 3 kinase to come and continue the pathway. But in the case of in the case of too many fatty acids circulating in the blood, which is usually caused from obesity, this is not allowed to happen because the diacylglycerol stimulates the protein kinase C to phosphorylate other parts of the IRS protein, which basically inhibits the tyrosine residues to be phosphorylated. And then this is thought to be right now the cause of insulin resistance. It's still kind of being studied right now, but this causes the pathway to short circuit. So to recap, both type 1 and type 2 diabetes are characterized by high glucose in the blood. They are both a result of the inability to proceed with the insulin pathway. So in type 1 diabetes, it is an autoimmune disease where the body attacks the pancreatic beta cells. No insulin in the blood leads to high glucagon, which leads to gluconeogenesis. This means that glucose is reformed even though there's a lot of glucose in the blood. This often ends in fatigue, frequent urination, diabetic neuropathy, and more. And usually people with type 1 diabetes are skinnier than normal. Weight loss is another result of this because their fat is constantly being broken down. Type 2 diabetes is associated with obesity. It has fatty acids circulating in the blood, which means triacylglycerol in the muscle. Triacylglycerol in the muscle means diacylglycerol is also in the muscle. Diacylglycerol signals protein kinase C to phosphorylate serine and threonine residues instead of tyrosine, effectively blocking the insulin pathway, leading to insulin resistance. So that's your short lesson on type 1 versus type 2 diabetes. I hope you learned something, and have a good one.